Hi, I'm Dr. Suze, owner and founder of Wildflower Pediatrics, board certified pediatrician and neonatologist. Today, I want to talk about the information that I like all parents to gather after the delivery of their baby. This information is helpful for me when it comes to caring for your newborn. One is your baby's birth weight. I like to know what weight they were born at, and then I like to know what weight they were when they were discharged from the hospital. I expect all babies to have lost some weight in those first couple days of life, and I like to know how much weight that was lost. Two is the bilirubin. I like to know what your baby's bilirubin was. This should be checked in most babies. And then I also like to know mom's blood type and if it was checked, baby's blood type. This helps me to also decide if high bilirubin is going to be an issue for your baby and if it needs to be monitored when they come and see me. The other thing I like to know about is if your baby passed their hearing screen, super important. If they didn't pass, I want to make sure that we're following that up and getting it repeated. The other thing that I like to know about is if baby has received some of those medications and vaccines that are recommended after delivery. So that's the erythromycin eye ointment for preventing eye infections, the vitamin K shot that is for preventing bleeding in baby, and then the first hepatitis B vaccine, which is often given in the hospital unless it's been requested not to be given at that time. Having this information is super helpful for me in preparing to follow up your baby. The other things that are also important that don't necessarily just have to do with baby, but with mom, are any things mom experienced during her pregnancy or delivery, any complications or medications that she was needing to take, whether it be during the pregnancy or during delivery. For example, was your OB concerned about infection? Did they have to start you on antibiotics? That's important information for me to know. If you have any questions or concerns about any of these things that I've talked about today, please don't hesitate to reach out. I'm hoping this video just makes it a little bit easier in understanding what you need to know during this busy and sometimes stressful time.